Lie on your back with your legs bent over a chair or an object that allows you to get a 90-degree angle bend at your knees and your hips. Make sure that your ankles are not higher or lower than your knees at any point in this position. The object must allow you to relax your legs completely so you don't have to use any of your own muscles to keep your legs in one position. If you notice that your knees are falling out apart from each other, you can place a strap around them that will allow them to relax into the strap so they don't fall outward. Make sure that the strap doesn't have any kind of elasticity to it so that it presses in against your knees. You're going to place your arms out to your sides at a 45-degree angle from your body with your palms face up. Allow your lower back, hips, and shoulders to settle into the floor on their own. Balance and symmetry check. Pay attention to how your back, your hips, and your shoulders feel as they're lying against the floor. Do you notice that one side of your hips or other parts of your backs or shoulders is touching the ground or heavier into the ground more on one side than on the other? Take notes of any of these differences that are on one side of the body versus the other. They should settle down and become more symmetrical by the end of this position. You also have the ability to lie in this position for anywhere up to 10 to 15 minutes if you notice that you don't settle completely into the position. But it's not necessary to go longer than 10 or 15 minutes. Stand with your feet facing a wall about 3 to 5 inches away from the wall. Make sure your feet are hip width apart, parallel to each other, pointed straight ahead. Place your hands on the wall just above hip level with your fingers pointed down at the floor. Make sure your hands are completely flat against the wall. There should be a mild stretch in the forearms, but it doesn't have to be a deep stretch. If you feel like there's too much of a stretch or you can't get your palms all the way against the wall, slide them down just a little bit until you can. Slowly allow your body to lean into the wall, letting your shoulder blades come back together as you move. Keep your ankles, knees, shoulders, and hips stacked in a straight line at all times. Your stomach muscles should remain relaxed. Hold this position. Balance and symmetry check. Do you feel a difference in how your shoulders glide from one shoulder to the other? Do you feel differences in your arms or maybe the stretch in one forearm? Is it easier to get one palm against the wall than the other? Do you feel tension or muscles in your neck working? All of these are asymmetries and should even out and become easier over time. Stand with your heels, butt, and upper back against an open wall, with your feet pointed straight ahead about 4 to 5 inches apart from each other. Bring your arms out to your sides at shoulder level with your palms facing away from the wall, arms and the back of the hands touching the wall. With your stomach muscles completely relaxed, bend at the waist so your upper body slides against the wall towards one side. Keep both sides of the hips touching the wall as well as your shoulders and arms. Try not to let your arms move. Rather, make sure it's the trunk that's moving and you're bending at your side, keeping your hips in the exact same place. Bend from side to side, sliding against the wall. Once you've done the recommended amount of repetitions on both sides, you're going to widen your stance so that your feet are approximately 1.5 feet apart. You're going to repeat the exact same movement, making sure that the feet are pointed straight, that the hips do not slide from side to side, and the weight is even on both feet, and you're bending from the trunk. After you've done this second position, you're going to widen further from 2 to 2.5 feet apart. Continue the movement again for the recommended amount of repetitions. Once you've done this, you're going to go back to the original stance at hip width apart and finish with the same amount of recommended repetitions. Remember, as you're bending from side to side, that your stomach muscles are going to want to tense up as you're going through the bend. Try to keep these as relaxed as possible. Balance and symmetry check. Pay special attention to any differences that you feel from the right side of your body to the left. Do you bend further on one side than the other? You might notice that you feel different parts of your body as you're going through the bend. Take notes of whatever things become apparent to you. As always, these are asymmetries showing up in the body and should even out over time. Lie on your back with one knee bent and the other leg straight out in front of you on the floor. Your arms should be out to your sides at a 45-degree angle from your body with your palms face up. Tighten the muscles in the upper thigh, the quads of the straight leg, and flex the foot and the toes back towards you. You want to make sure that the outside edge of that foot is pulled back towards you as well, keeping the quad, the muscle of the upper thigh, as tight as you possibly can and flexed, and pulling the foot back as much as you can. You're going to rotate that straight leg in and out with the movement coming from the hip socket. As you're rolling the leg, you want to make sure that your ankle does not move independently of the leg. For example, when you roll the leg in, you'll notice that your ankle wants to cave in and the outside edge of your foot rolls away from you. You must keep that outside edge of your foot pulled back towards you the entire duration of that rotation. You're going to rotate that leg in and out for the recommended number of repetitions, keeping the upper thigh muscle as tight as possible, and then you're going to switch sides. Make sure that you're keeping the upper body as relaxed as possible. You shouldn't be using any other muscles, such as the glutes, to help with the rotation. Balance and symmetry check. Pay attention to the difference between how the muscles feel as you're going through the rotation from one leg to the other. You might notice that it's easier to flex and hold the quad or the upper thigh tight in one leg than the other leg. You might also notice there's a difference in the ankles and how they feel from one to the other as you're trying to pull them back towards you. Take notes on your findings and recognize that these are asymmetries and they should even out over time. Lie on your back with both of your legs stretched out and your arms resting beside your body. Your palms should be face down. Your feet should be flexed with your toes pointed towards the ceiling. Simultaneously, raise one arm and the opposite leg. Keep your arm locked and straight as you take it overhead and touch the back of your hand to the ground directly over your shoulder. Bend the opposite leg at the knee as you pull that knee up towards your chest. Then return your arm and your leg to the floor. Make sure that you only bring your arm as far as you can over your head where you do not have to apply any force at all whatsoever to get there. Also, make sure that your elbow doesn't bend as you're bringing it over your head. Try to keep the movement of the opposite arm and leg to be as simultaneous as possible. As you're bringing your leg towards your chest, make sure that towards the top, your knee maintains a 90-degree angle. As you're doing the movement, the opposite arm and leg that are not doing any movement should be completely relaxed and should stay relaxed until the moving arm and leg reach the floor completely. Balance and symmetry check. Pay attention to the differences from one side to the other as you're moving the opposite arm and legs. You might notice that one arm can get closer to the floor than the other. You might notice that one leg moves easier than the other. This, of course, should even out over time. Lie on your back with your knees bent and your feet flat on the floor, hip width apart, parallel and pointed straight ahead. Place your arms out to your sides, in line with your shoulders and your palms face down. Cross the ankle of one leg over to the opposite knee. Once the ankle is on the knee, you're going to allow your hips to twist and fall towards the floor so that the knee and the bottom of the foot come in contact with the floor. If you can't get all the way to the floor, you can place something similar to a block or a pillow that will raise the floor up a little higher until your feet can rest on that. Keep your palms flat against the floor, and as you're rotating one direction, you're going to look in the opposite direction. Once your legs have hit the ground or the supported surface, you're going to press the knee outward away from you using the muscles on the outside of that hip. Hold this position. Make sure that you're breathing deeply through your stomach as you're holding this position. As you take a deep breath in, allow your stomach and your sides to expand. When you breathe out, let your stomach and your sides contract inward. Once you've held for the recommended amount of time, you're going to come out of this position in the exact same manner that you went into this position by twisting the hips back up. Then, place your feet back on the floor. Make sure that you have reset yourself and your feet are hip width apart again before you cross the opposite ankle over and do the other side. Balance and symmetry check. Do you notice a difference with how far one side goes compared to the other? Do you notice a difference in the muscles that are working in one leg versus the other when you're doing the actual pressing out of the knee? You might feel torque or tension in other parts of your body, such as your back, as you're going through the rotation. All these things are asymmetries and should even out over time. Lie on your back with your knees bent and your feet flat on the floor, parallel and pointed straight ahead. Your arms should be placed out to the side at a 45-degree angle from your body with your palms face up. Using the muscles in your hips, you're going to roll your pelvis backwards to flatten your lower back on the floor, and then tip your pelvis forward to create an arch in your lower back. You're going to move between these 2 points, attempting just to tilt the pelvis back and forward. As you tip the pelvis forward to create an arch in your back, use the muscles in the front of your hips and your back to create that arch. As you're tucking the pelvis underneath, flattening the back to the floor, use the muscles of your glutes and your abdominals. As you're tucking the pelvis, try to be very light on the feet and don't push your feet into the ground. Do this controlled and slow, trying to get as much range of motion as you can without activating or using any of the rest of the body. Balance and symmetry check. Do you feel muscles working on one side that are not working on the other? Do you have any kind of twinges or pains or discomfort in one part of your back or one part of your body that's not on the other side? As your pelvis learns how to create this movement and your body becomes more balanced, this should become more symmetrical with this movement and the pain should reduce. Lie on your back with your knees bent and your feet flat on the floor, pointed straight. Place your arms out to your sides at a 45-degree angle from your body with your palms face up. Very lightly contract the muscles of your glutes, your butt muscles, on and off. Notice how you can't see anything else in the body, including the pelvis moving as the contractions are happening. That's because you only want those muscles to be doing the work. Your pelvis should not move. If you notice that your back is flattening to the floor every time you squeeze, you're probably squeezing too hard and you need to lighten it up. Keep your stomach muscles completely relaxed throughout the duration of this position. Make sure you get a full squeeze, hold for a second, and then completely relax between each squeeze. Balance and symmetry check. Take notes of how the differences between the left and the right legs are as you're doing the squeezing. Does one glute work when the other one does not? Or is the timing off? Does one glute squeeze sooner than the other glute? This should even out over time. For this position, we're going to teach you first one of the most crucial parts of the form of the actual position. Using the muscles in the front of your hips, you're going to tip your pelvis forward so that you can place an arch in your lower back. What you'll want to avoid is using the muscles in the middle of your back and allowing your ribs to flare out and your chest to expand in order to sit up straight. Sit in the center of a chair with your knees bent at a 90-degree angle with your feet parallel and pointed straight ahead. Place a block or a pillow between your knees. Make sure that the block or the pillow is anywhere between 4 to 6 inches in diameter Make sure that the block of the pillow is firm enough to where you won't be able to squeeze your knees closer than 4 to 6 inches together. Using the muscles in the front of your hips, tip your pelvis forward and create an arch in your lower back. Press into the block with your knees on and off, using about 50% of your overall strength. Keep your stomach muscles completely relaxed throughout the duration of this exercise. Your hands will be palms face up on your lap. Repeat this movement for 60 repetitions. Balance and symmetry check. You should be able to feel the work in the muscles on the insides of your legs, as well as the muscles at the front of your hips, your hip flexors. You might notice that one leg maybe pushes more into the block than the other leg, or you feel the work more in one hip than the opposite hip. You also might notice that when you're sitting, you can feel both sit bones underneath you. One might be heavier or in a different position than the other. It might not feel quite balanced. The goal of this position is to have those things completely even out throughout doing this position over time. Lie on your back, face up, with your legs straight up on a chair or some kind of surface that is about 18 to 20 inches high. Your ankles should be at the edge of this chair. Place a block or pillow between your ankles, making sure that the block or the pillow is between 4 to 6 inches in diameter and is firm enough to where if you were to squeeze against it, it wouldn't actually squish in. Your arms should be out to the sides at a 45-degree angle from your body with your palms face up. You're going to hold both of the inside edges of your feet and ankles against the block. You don't necessarily need to press into it, but make sure that the entire inside edge of your foot, as well as the ankle bone, is touching it. Flex your feet back towards you, as well as your toes, so that they're pointed towards your head. You'll also want to make sure that the outside edge of both feet is pulled back to where it's about the same distance away from you as the inside edge of both feet. You're going to hold this position just pulling the feet back towards you and making sure that the inside edges are touching the block for the recommended amount of time. Keep the quad muscles as relaxed as possible, as well as the pelvis and the upper body. You want to make sure you're breathing deeply in and out through this position. You should eventually feel the muscles in the hip flexors, but you might start to feel the work at the shins or the ankles. Balance and symmetry check. Do you notice a difference on how some of the muscles on one leg work differently than the muscles on the other? Do you feel one hip work sooner than the other hip? Maybe you notice a difference in how the ankles feel touching or pressing into the block. Either way, these are asymmetries showing up in the body and will improve over time. Place your back against a wall and keep your feet and knees about 6 inches apart. From here, you're going to walk away from the wall until you can allow yourself to slide down and put yourself in a seated position where you are about just over a 90-degree angle at the hips as well as the knees. The goal here is to have your mid-back, lower back, and hips completely flush against the wall. It's almost as though you're going to have a small slouch in your back and your posture in order to make this happen. Your head and shoulders will slightly come off the wall. Keep all of the pressure in your heels, relax your stomach, put your palms face up on your lap, and make sure that you do not use your upper body or shoulders at any point in this position. Keeping the pressure in your heels, you're going to hold this for the recommended amount of time. If you feel like a lot of the work is going into your knees, you can come up slightly until you don't feel the work in your knees anymore. You should feel the work in the upper thigh muscles, the quadriceps. Balance and symmetry check. Do you feel like both legs are working evenly, or do you feel like one leg is pushing into the ground or the wall more than the other? Take note in how even it feels where your back and hips are up against the wall. You might feel like it's not symmetrical from left to right, like certain parts of your back or your hips are touching the wall more than other parts. One thing that you can do if this is happening is to place a yoga block or some type of firm pillow between your knees where you're not necessarily going to squeeze it, but allow your knees to press into it, just enough to hold it, and see if that makes things even out. Over time, it should even out as things become more symmetrical.